Hello and welcome to today's video from Finity Therapy. In today's video, I'll be talking about ADHD, otherwise known as Attention Deficit Hyperactivity Disorder, and I'll be talking a little bit about it, but more so focusing on adults. I'll also talk about the symptoms, the causes, and the kinds of treatments that you might be able to get if you or someone you know experiences ADHD. So let's just talk about what this is. ADHD is considered a developmental disorder by psychiatry, and it's often detected in children because it is a developmental disorder. So it's often seen early on, normally between the ages of 3 and 7 years old. The kinds of symptoms that can come about, and usually they are at times of transition. So for example, if a child is starting a new school or changing schools or any other kind of transition, symptoms might more readily manifest. What are the symptoms? It could be things like restlessness, impulsivity, lack of focusing and concentration, sometimes anxiety as well. If the symptoms aren't detected in childhood, this means that they can be harder to notice as we grow, because adults and children can behave quite differently when they're experiencing difficulties. And so in adults, these kinds of symptoms that I'm going to go into can be a bit more easier to hide, really, I guess, but not in a purposeful way. It's just we behave differently as children. But before we go into the symptoms, let's just talk about the other attention disorder that exists. So there's two attention disorders. There's ADHD, which I've just mentioned is attention deficit hyperactivity disorder. And then there's ADD, which is attention deficit disorder. Now this one just loses the hyperactivity part of ADHD. So just notice there's a difference there. One of them also has this element of restlessness, impulsivity, that hyperactivity, whereas the other one is more likely where someone is experiencing difficulties with concentration, with focusing. And so it's thought that 20 to 30% of people experience this form of ADHD, which is ADD, the other attention disorder. Now, thinking about ADD, if we're thinking about how it might be difficult to detect ADHD in adults as compared to children, just think about how it might be also harder to detect ADD, because we lose the hyperactivity, the impulsivity, this more overt affect that ADHD seems to have. And this also means that women are often undiagnosed with ADHD and ADD, because women also, their behavior is less overt than it is for men. So there are a number of ways that ADD and ADHD manifest, but today's list that I'm going to just go into will be talking about ADHD, so there'll be the other element of it as well. So people with ADHD will experience a number of symptoms. So things like carelessness, being unable to prioritize, a lack of attention to detail, being impatient, sometimes irritable, so having these unstable moods at times, a lack of concentration, sometimes experiencing poor memory, speaking out of turn and sometimes blurting things out and interrupting people as well. So leaving tasks unfinished only to start new ones, not being able to organize well, not being able to focus or concentrate, sometimes losing things or misplacing things, being unable to manage stress. Sometimes also risk-taking behavior. This could be behavior that risks you, the person who has ADHD potentially, and risks other people as well. As an example, it could be something like drink driving. And then there's the difficulties in socializing and with relationships. So this really is quite extensive if you really think about the symptoms that someone might experience if they have this problem, this condition of ADHD, and how it can be quite difficult for them. The other thing to think about is often with mental health conditions, there can be a comorbidity. So that means that there could be another difficulty or problem, another mental health condition or disorder that exists with that person, as well as ADHD or ADD. This can be quite difficult. So for example, someone with depression or anxiety, these are quite common. And also with ADHD, it just really makes things very difficult and harder for that person to manage. So now I'm going to talk about the causes of ADHD and ADD. Now, there have been brain scan studies, research done on this condition, and it's been noted actually that the brains of people with ADHD and those who do not have the condition, they do differ. So some parts of the brain are larger and some parts are smaller in those who have the condition and those who don't. With any mental health disorder, there's often, and I think I would say always the case, that there's no one direct cause. So that means it's not just genes and it's not just environment. It's usually an interplay between the two. So those who have ADHD can often have another member in the family who experiences the condition. So sometimes it could be a sibling or a parent as well who has the condition, and this tells us that there is a genetic component. The other thing is the environment. So if you are born to a mother who perhaps used substances whilst pregnant, and this includes cigarettes, this includes alcohol, then this can potentially create a predisposition to this condition. Also, if there's any kind of brain damage, so for example, if someone has epilepsy or if they've suffered brain damage whilst in the womb or whilst after, during birth, if they have a low birth weight, all of these kinds of things can affect potentially having ADHD. So as I said, because it is hard to detect, especially in adults, if you haven't been diagnosed with ADHD or ADD, which is even harder to detect, and you suspect that you have it or someone else might have it, the first thing to do really is to go and speak to your GP, general practitioner, your physician. Ensure that you tell them about your symptoms and tell them what you suspect. And then often they will do a preliminary examination. They won't give you a diagnosis themselves, but if they believe that further investigation needs to happen, they can then refer you to, say, a psychiatrist who can then do a more extensive examination and determine whether you might be experiencing ADHD or ADD. Once you obtain a diagnosis, if that is indeed the case, there are certain treatments that you can look at. Just knowing, though, that you have the condition is really important, because although there's no cure for ADHD or ADD, the symptoms can be managed. It's just knowing if you have the condition so that you know what to do. So, for example, in terms of managing ADHD or ADD, some people will use medication for this. This is something they will discuss with their psychiatrist or their GP. To ensure that they get the right kind of medication to help them manage their symptoms. It's always important, though, if you're concerned when it comes to medication, which I think we all should be, to be vigilant about those kinds of things. Always check with your physician, talk to them, ask them the right questions, tell them about any side effects you might experience. Do have medication reviews to make sure that if you are on medication or if you're considering medication, that you know and you feel assured that that's the right way to go. And of course, alongside medication, or sometimes not, on its own, you can have psychotherapy. So therapy is a way for you to learn about your symptoms, what might be triggers as well, what the symptoms look like, how often they happen, what kinds of things affect how you're feeling and how you're coping and how you're managing those symptoms. And then once you know that and you have that awareness, you can start to learn to manage them. So really tuning in to how things happen for you and how they might change. Something like cognitive behavioral therapy, CBT, or behavioral therapies can be really useful for something like ADHD. So this is something you could consider alongside or instead of medication if that's something that doesn't agree with you. And just on a final note, when it comes to something like ADHD, it is very difficult for the person who's experiencing it. And of course, this means that it can impact people around the person as well, who is watching their loved one, their close other, experiencing these difficulties, but also does get impacted by that other person themselves. So again, this is another reason why seeking support for this condition is important, because it helps you, but it also helps those around you, and it helps them to learn how to support you better and also to feel supported as well. So thank you for watching today's video. I hope it was informative. I hope you enjoyed it. And if you want more information, a bit more detailed than what I've gone through today, you can look at the associated blog article that I've written about this condition. It's just linked below. I hope you'll subscribe if you want more information from us about mental health conditions, anything relating to psychology essentially. That's what we will be releasing, and that's what we do talk about. So we hope you'll join us for more videos, and I look forward to seeing you soon. Thanks for watching.